One of the biggest things the pandemic has impacted comes in the form of mental health. Students not being in class, businesses closing, and lifestyles changing all cause some mental health concerns. 23 ABC's Calvin Hodman finds out services were up to those in need.
Take a moment and think about when you realized COVID-19 is something big, something real, and something not going away anytime soon. Even in those moments, none of us could have predicted how big of an impact the pandemic would and still does have on our mental health.
Depression, anxiety, stress, worry, everything kind of exacerbating on top of the situation that we've had to go through for the last 12 months.
Mental health has been put to the test for many people in the past year. For example, Kern Behavioral Health and Recovery Services saw 800 more calls come into their mental health crisis hotline in December 2020 compared to December of 2019.
I think initially we kept waiting for things to come back to normal, and it took a while for us to realize that this is going to be our new normal.
Behavioral Health Director KEHRS says people who had never before dealt with anxiety or depression were thrown into stressful situations. Those already facing mental health issues, especially younger people, found it even harder to cope.
The one thing that I notice about kids is they are just very intuitive and always very in tune to what's happening around them in their environment. So family stress is 100% going to be affecting them.
Still, according to Program Support Supervisor EGGERT, Kern County did not see an increase in suicides during the pandemic. But she says suicidologists believe there may be an increase at the end of the year.
People who never had thoughts, more are having thoughts. And we see that with our youth because they're not, with each other. And we see it with adults too. So the biggest thing is most people think it can't happen to them or their family. And so we've got to become more suicide aware.
Especially for kids. EGGERT says most parents talk to their kids about drugs and alcohol, but not suicide. She says that needs to change, especially with the end to the pandemic not quite in sight.
Because we're talking life and death here, but we all have to get comfortable with it.
Kern Behavioral Health offers a free 1-hour suicide awareness training. EGGERT encourages everyone to take it.
It just talks about warning signs, how to ask the question, all of those things that if we could erase that stigma and realize that suicide prevention is everybody's business, but also every single one of us at some time in our life could be at risk for suicide.
Even as we're beginning to see more vaccinations and fewer restrictions, EGGERT says we need to be taking care of ourselves.
The good thing is there is light at the end of the tunnel, but that tunnel's long.
The suicide prevention hotline number is right there on your screen. It's 800-273-8255. We'll also have links to more resources on our website, turnto23.com. Here in Bakersfield, Calvin Hodman, 23 ABC, connecting you.